Our lovely patient is now 6 months out from a reconstructive surgery. She has had numerous basal cell carcinoma, skin cancer, removed from her face, especially her nose. As a matter of fact, just like I did, I had skin cancer removed from here back, let's say, about 24 years ago. And with that skin cancer removal, my nostril, just like this lovely patient, pulled up. So this nostril was elevated up. So to have that fixed, I had to have what we call a composite graft. Skin and cartilage taken from the ear and put on the outside of my nose to lower my nostril. Well, that is exactly the same procedure we did for this lovely patient. Plus, we took from her other ear another composite graft to put inside the same right nostril. So now when we look at her 6 months, she is not perfect, but now when we look at her, her nostrils are more symmetric. She's still swollen on the inside, and she's gonna do great over the next 6 months, but her breathing is a lot better. And one thing she goes, you know, Dr. Nassif, I've had so many skin cancer removals, especially in the nasal area. Can you please do something to make my nostrils more even? And it looks like we did a great job doing that.